Urethral pathology includes clinically significant disorders, such as infectious processes like urethritis and traumatic situations that affect the continuity of the urinary tract. They manifest with dysuria, urethral discharge, hematuria, or urinary retention, impacting quality of life and carrying the risk of serious complications if not diagnosed and treated promptly. Specialization in this field allows for a comprehensive approach to these pathologies, from identifying risk factors and clinical findings to the use of diagnostic tests such as urinalysis, exudate smear, ultrasound, or retrograde urethrography in trauma cases. Mastery of etiological agents such as Neisseria gonorrhoeae and Chlamydia trachomatis, and the ability to differentiate partial or complete urethral injuries are essential skills for safe and effective management. Training in urethral pathology constitutes an academic and scientific cornerstone, granting professionals the ability to apply treatments ranging from combined antibiotic therapy to surgical repair in severe cases. This personalized approach not only improves immediate prognosis, but also preserves urinary and reproductive function, consolidating clinical leadership based on prestige, innovation, and commitment within emergency medicine and modern urology.